My name is Adam Fazio. I'm a urologist in Miami, Florida, and my practice is called Miami Men's. My education, I did my undergraduate work at Columbia University. I returned to Columbia for med school, and then I did my general surgery and urologic surgery residencies at the University of Minnesota. Yeah, so Miami Men's, our focus really is on male cosmetic surgery, cosmetic urology, and overall sexual health and wellness. My main focus, my main passion at this point really is penile enlargement and scrotal enhancements. So the Himplant, previously known as Penuma, is a silicone block implant made to increase penile size. It's a subcutaneous implant, so this is just inserted right under the penile skin to increase girth in the flaccid state, also increase length in the flaccid state, and overall increase size in the erect state by giving guys increased circumference of the penis. So the surgery is relatively simple. It's a straightforward concept. It's an incision right through the scrotum, so the sac that contains the testicles. Through that incision, you're able to dissect up to the penis, place the implant right under the penile skin where it's just sewn in right behind the head of the penis, and then sort of customize each patient. The whole thing can take anywhere between an hour and a half. Pretty straightforward under general anesthesia. So the immediate post-op care is at least 3 days. So all my guys, day after surgery, we see them, we take down their initial bandages, put on something called a Euro wrap, which is just a compressive dressing around the penis. Second day, do more or less the same thing. The third day, we take out a surgical drain that we leave in place. If everything looks good, the guys are good to go home. Occasionally, people need to stay a few days longer. So we ask everyone to at least make their plans. They can stay at least 5 days in Miami. So that's the general post-operative care. In terms of the post-operative period or the post-operative recovery, I tell all the guys this is an 8-week project. So those first 4 weeks, I ask people to take it easy as much as possible. They can go to the stores, they can go to restaurants, they can walk around and do a lot of normal activities. But those first 4 weeks, absolutely no sex, no exercise of any sort, avoiding strenuous activity, and just really focusing on the recovery and allowing the implant to sort of set in place as best as possible. After 4 weeks, if everything's going well, I'd like guys start doing some upper body exercise. 6 weeks, we check in again. Everything's going well. You can start some lower body exercise. 8 weeks is really the key point where we sort of set guys free. So full exercise and start experimenting with sex. No, so everyone is curious, does this affect ejaculatory function, erectile function, their ability to urinate? The way the implant's designed actually wraps around the penis 270 degrees. So when I talk to guys about penile anatomy, I say, think of 3 cylinders. You have 2 on top called the corpora cavernosa that fill with blood during an erection. 1 on the bottom called the corpus spongiosum, which carries the urethra, which allows us to ejaculate and urinate. The implant actually just wraps around those top 2 cylinders, right? So it doesn't touch the bottom cylinder that carries your ejaculate and your urine. So it has no effect whatsoever on your ability to urinate or to ejaculate. In terms of erectile function, implant does not impede or not change your erectile function in any way. So guys still enjoy their full erectile function. And need be, they can still take medications for erectile dysfunction after the implant's in place. I really looked at the implant in depth. I saw a device that has a really profound impact on guys' lives. It's a relatively simple procedure, and it has a really acceptable side effect profile. And one of the things I really liked about it is that the implant can be removed, still allowing guys to have full sexual function and normal anatomy afterwards. So if you compare the implant to, say, the inflatable penile prosthesis, which a lot of people are familiar with for sexual function, that completely undermines and destroys your natural anatomy. The implant is just a subcutaneous implant, does not change your penile function, does not destroy the erectile tissues. So this can be removed in the case that someone has a complication. The most common complications when I think about the implant, seroma formation. So this is just an inflammatory fluid around the implant. can usually be managed with compressive dressings, steroids, and in really rare cases, when it's persistent, we could actually aspirate the fluid out. It's a common complication with any cosmetic procedure, so it's something that there's a lot of experience out there with it. And constantly, as we revise techniques, we're getting better and better at reducing those rates of seromal formation. Other complications, infection. The infection rate for a Himplant, really low. It's stated around 3%. And it's an infection that we know how to manage well. About half the cases have been salvaged. The other half do require removal of the Himplant. To partners after insertion, especially in the flaccid state, I tell guys, if you look at a photo, no one's going to notice that there's anything there, right? It looks really natural. And for me, this is probably the most important thing about the Himplant. When I compare it to other forms of penile enhancement, it looks natural, it looks real. You're not going to really tip anyone off to the presence of a Himplant just by looking at you. Obviously, the first few weeks after surgery, you've noticed that there's something under your skin. It's a process, right, to get used to having this in there, but with time, it becomes part of your body and it's the new you. In terms of your partner, visually again, no one's really going to notice. That's your long-term partner who you're with every night. Of course, they may be able to find some subtle edges. They may be able to find some evidence there's something under your skin. I tell guys it's not that different from a breast implant, right? They look great. They feel nice. It doesn't turn anyone off. It's not something that's going to send your partner running. They're going to like it, but they'll notice that there's something there. When I launched my practice, I gave all the options for mal enhancement or penile enhancement a fair sort of review. I wanted to withhold judgment so I could really look at what are the effects, what are the benefits, what are the side effects. And after looking at them all, I only offer Himplant. And I think it's for good reason. I think it's the only option that offers a realistic appearance, a consistent appearance, a realistic feel, and a long-term effect for guys looking to enlarge their penis. So when we think about perhaps the most classic form of mal enhancement, it was the incision or the release of suspensory ligaments. So at the base of a guy's penis, there are actually some ligaments that basically anchor the penis to the pubic bone, allows it to follow that natural trajectory that's upward when you get an erection. And so guys initially thought maybe by incising this ligament and letting the penis hang a bit lower, it would provide guys with increased length. And it does work initially. It gives that appearance of increased length. The challenge is it's just length, right? So it's not increasing girth in any way. And it's not really permanent. It's not durable. A lot of guys, that ligament's going to end up scarring up, actually resulting in a smaller penis long term. So for me, that was not an acceptable sort of side effect profile in terms of what I would offer to my patients. I'd say the most common form of enhancement I see in Miami at this point is injections. So whether it's with fillers or whether it's with silicone, I see a lot of this right now. This was something I briefly reviewed, and after seeing my first patient with injections, I realized this is something I would never offer my patients. If I were to explain it to someone, it's almost as if shoving your penis inside of a marshmallow, right? It does not have a natural look. It has this sort of ballooned out look that doesn't look natural, doesn't look attractive. And the feel of it, it's again like a marshmallow, soft feel outside the erection. So you can imagine having sex with this. You're not gonna have that nice sort of rigid erection that is natural, right? So it doesn't look right, doesn't feel right, and not permanent. And so that's the reason why I never offered injections, and I'm not going to offer them going forward. I think it's really important that patients know that if you've had injections in the past, whether it's fillers or silicone, you're no longer a candidate for the Himplant. It makes this procedure really difficult. The tissues are way too inflamed to be able to get the implant in there safely. So it's something that guys really need to think about before going down a route which initially may seem easier. But in the end, it has to be repeated, does not provide the same consistent, realistic look, and ultimately prevents you from going down the sort of the Himplant route. So I think in our experience at Miami Men's, we have really got a good sense of who the patients are who should be doing the Himplant and the guys who probably should avoid it at this point. Let me start with who should avoid the Himplant. So I think we get calls about guys wanting to surprise their partners. Right? That's not a great reason to do this. People who want to win back a spouse, also not a great reason to do this. This is something that you want to do for yourself. This is something about your own confidence, something that's sort of independent from whoever you're with at any time. I really like the guy who calls up and says, I've spent my whole life avoiding very particular situations. So whether it's the locker room, whether it's team sports, whether they've always wanted to go to a nudist beach, whether they are a nudist and just aren't comfortable with what they're doing. A lot of guys just don't like walking around naked in the house with their wife. They don't like taking a shower with their partner. That really specific motivation that's all about them, not about giving something to their partner, not about winning someone back, not about pleasing someone else. That's really the patient we want. And that's the guy I think I could deliver the best result for. So any guy interested in the Himplant usually takes the first step of going to the Himplant website, learning about the implant, introducing their own information, having a conversation with our partners at Himplant, right? Who do the initial screening, who make sure the guy meets all of the basic criteria, make sure that they're a good candidate. Once that's happened, the patients then are put in contact with my office. I have a surgical coordinator, a surgical concierge who does an excellent job of really helping guys through this process of taking them from the website to my office, whether it's in person or whether it's virtual. We make it a really easy process for guys to sort of have this seamless experience. And it's a nerve-wracking experience for a lot of guys. So we take really additional steps to make this easy. And we try to support them in every way we can. So at Miami Men's, our clinic, we offer a series of scrotal enhancements. And the goal here is really to address a variety of complaints and concerns guys have come to me over the years with that really weren't being met elsewhere. So I think our two most common complaints or the common procedures that we do would be scrotal lift and scrotox. And I'd say this is kind of the yin and the yang of scrotal surgery or scrotal procedures. So a lot of guys have sort of a low-hanging scrotum. Something that makes them feel old, something that may be uncomfortable, something that they may sit on occasionally. And these guys come to us really to have that lifted up, to have a more youthful look that not only looks more youthful, but also changes that ratio between the penile length and the scrotum. It's overall just a more attractive look and more comfortable for a lot of guys. On the sort of the flip side of the coin, I have other guys who really want their scrotum to hang lower. They want sort of those larger appearing testicles that hang low and swing free and who enjoy sort of a nice slap during sex. And those are the guys who come to us for scrotox. So this is really just injection of Botox into the scrotal muscle, really provides that relaxation that a lot of guys like. So the condition is called a priapism. So this is an erection lasting longer than 4 hours. There are a few things that will cause this. I mean, there's some rare ones, certain medical conditions, but the vast majority of guys I see coming through the emergency room with a priapism, it's medicine induced. So there are guys who do something called intracavernosal injections. So this is an injection right into the penis to induce an erection that can easily be overdosed, resulting in an erection that just doesn't resolve by itself. The other one I see quite a bit of is guys taking over-the-counter pills for erections that they buy in gas stations. I saw a 36-year-old guy last year who took a pill called African Superman, and he came in after 24 hours with an erection. At that point, there's really little you can do to salvage their function long-term. So really the risk of having an erection that long is you're not getting oxygenated blood to the penile tissues. They become fibrotic, and you really lose much of your ability to have an erection afterwards. So vasectomy is a really common procedure. It's one that there are a lot of misconceptions about. In general, there's really only one benefit. You have a vasectomy because you want to avoid further pregnancies. There are additional reasons to do it. You think about sort of the consequences of an unwanted pregnancy. A lot of guys, this can be a great asset protection tool. So we have a lot of patients coming to us saying, I love my kids, I love having children, but I just can't afford to have additional children. So that's one of the only reasons really to do a vasectomy. For years, there have been myths about sort of other risks and benefits of the procedure, but that's really it. It's to avoid having additional children. So vasectomy is technically reversible, and there are some really good surgeons out there who can reverse a vasectomy with really high success rates. However, when I have a patient come into my office, I tell them, you have to really conceive of this. You have to think about this as being an irreversible procedure, because I can't guarantee they won't fall within that small percentage of guys who are unable to reverse it. Additionally, it's really expensive to reverse a vasectomy, so it's oftentimes sort of cost prohibitive to do it. So really you have to go into this with a commitment that this is a long-term permanent procedure. So our clinic really offers two approaches to vasectomy. There's the standard approach, we do it in the office, and we're also offering a home vasectomy service. So we'll go to a guy's house and we'll do the vasectomy from the comfort of their own home. And we really conceived of this. We thought about doing this because we had so many guys last minute calling up, not quite sure about the decision or not really able to overcome the anxiety of getting in their car, driving to our office and having the vasectomy done. So this is really designed to address those guys who need a little help getting to the decision and having us, get to their house and make this a really comfortable, easy procedure.